When you receive your products, you're going to open your box and there'll be 2 devices, 2 socks, and 8 tubes of cream. During your educational session, you'll only need 1 device, 1 sock, and 1 tube of cream to go over everything, and you'll actually be putting these on for training. First, you're going to take the device out of the package. You're going to see the package has a perforation at the top that will need to be removed. Once that's removed, inside the package will be a black mesh bag. It will have the device, the battery, and a black strap. You'll go ahead and set the black strap to the side for now, and you're going to go ahead and get your battery out and put that in place. You're going to hold the device in your left hand, either facing you or to the side, and you'll pull back, straight back with your thumb on this compartment, and that will open the battery compartment. The flat piece will go to the spring. You'll put the battery in place and then put the plastic back in place. On occasion, it is difficult to open, and it does feel like you're breaking it, but it is okay to push back on it to get it open. From there, you're going to go ahead and open up your sock. This is the bag the sock will come in. Again, it will also have a perforation at the top. And once you take that out, your silver Thera sock will be a dark gray and a black stripe. It will also have 2 black snap connectors near the black stripe. To take those off, you're going to want to get your thumbnail underneath the black snap connector and press down with that thumbnail so that it gently pops off. You do not want to pull on these because it will create a hole over time. We're going to need to take both of them off and put them on the end of the device. And from here on out, you will be snapping in and out of the sock instead of trying to put the wires in and out of the snap connector. When you do put the snap connector on, you do need to look at the very tip of that black snap connector. It has a hole in it. That is where you're going to be sliding it onto the wire. Because both snap connectors are the same, you can slide either one onto the end of the red wire or onto the end of the black wire. Please ensure that you cover all of the silver when you're putting this on. Next, we're going to run through how to use the device before we put everything together. So you're going to hit the middle button on the device, and it's going to say P1 on the screen. P1 is only a 30-minute treatment. We seldom use this for patients except for titration. So we're going to most likely always be using the P2 setting. So you will hit it a second time in the middle. It will say P2 on the screen. P2 is a full 8-hour treatment, and this is what you'll be using for your nighttime treatment. Some patients will do daytime treatment. What we ask is that you get 8 hours within a 24-hour period. Once you're on P2, you're going to use your right up arrow key, and you're going to increase your voltage, and you're going to go to the setting that the clinical educator tells you for your diagnosis. On average, you're going to go up to 50 for diabetes and 60 for non-diabetic neuropathy. For other issues, again, your clinical educator will instruct you on the appropriate setting for the device. It takes approximately 1 minute for the device to start timing out. So we're going to show you how it times out. When it does start to flash back and forth, it's going to flash between P250 and the time it's counting down, so it will show either 7 hours and 59 or 58 minutes. Once it starts flashing back and forth, the device will be locked out. What that means is if you are to hit your up or down arrow keys, the voltage is not going to move. That is a safety mechanism so that while you're sleeping at night, should you accidentally hit a key, it's not going to turn the device off or move the buttons up and down. We will show you how if you hit the arrow keys right now, you'll see the voltage does not move. And you see the voltage stays at P250. So again, that lockout mechanism, if you need to move the voltage again, you hit the middle button 1 time, it will release it, and you'll see that you can start moving the voltage again by moving up or down. If you wait another minute, it will lock out on you again, so it does this repeatedly for safety. We're now going to shut the device down so that we can put everything together. That's by holding the middle button for 5 to 8 seconds until the lights go out. Now we're going to set the device down and open up your tube of cream. You'll want to unscrew the top so that you can take the silver seal out of the way, and then you're going to put the top back in place. Now you're going to go ahead and set that down and take your shoe and sock off and bring your pant leg up to your knee. First, you're going to apply a nickel-size amount of cream, and you're going to apply that to the top of the foot, the bottom of the foot, and the toes. This is just a guide. If your foot is smaller or larger, you may need to apply more. So you're going to first cover the foot thoroughly. You want the top, the bottom, and the toes. Then you're going to go ahead and apply another nickel-size amount to cover the rest of the leg to just below the knee. And you want to make sure you cover the front, side, and back of the leg, all the way to just below the knee. Now, each sock goes up a little different in height, so once you do put the sock on for the first time, you'll start to learn where you're going to land as far as the sock and how much cream you will need to apply up to below the knee. Now you're going to go ahead and apply your sock once all of the cream has been applied to the leg. When you have applied all that cream from the tip of the toe to just where the top of the sock touches is where the cream will be. Next step is going to be taking the black strap. This is going to be going around the black stripe on the sock. You're going to want to open this strap up all the way, and you're going to see that there's a square end and a rounded end. You're also going to notice one side of the strap has soft, fuzzy Velcro on it. You'll also notice near the rounded end, there's a doubled over layer of material. That's where the device is going to be going into. So once we get the device or the strap in place, we'll ensure that that lands in between the silver snaps. So the way to put this on is you're going to lay the square part of the strap down first with the soft side of the Velcro facing out. Then you're going to bring the rounded end behind the leg, come back around the front and go past the square end and then stick it to itself. You want to make it snug enough that it stays up, but not so tight that it's uncomfortable. You always want to make sure that the little pocketed area is moved in between the silver snaps. That's going to be where we place the device, but first we're going to put the device on the sock and get it turned on before we do that. So now we're going to snap the red lead into the sock at the top. So we always say red to the heart, and the black is going to go to the bottom or towards the foot. From there, you're going to want to go ahead and turn your device on. Again, you're going to hit the middle button 2 times to P2. From there, you're going to use your voltage and increase to 50 volts. Again, this is for diabetic neuropathy. Please make sure that you're speaking with your clinical educator about the appropriate voltage for your diagnosis. This is a standard for diabetic neuropathy, but not for all patients. So please ensure you get your correct voltage from your clinical educator. Once the device starts flashing back and forth between P250 and the 7 hours and 59 minutes, then we'll be capable of putting it into the strap. Now you're going to unsnap the red snap or red wire from the top, and you're going to want to weave that through from the bottom into that space, and you're going to bring it through gently. Please do not pull and stretch the wires if you can help it. Then the device is going to go in sideways, and that's going to assure that the red wire comes out the top and the black wire comes out the bottom safely. And you're going to snap that back in place. Now again, don't worry about the fact that you can't see the device because it is locked out for safety at this point, and it is counting down from the 8 hours and will shut off automatically after the 8 hours. Also, if you're having problems with the snap staying in place, you can put another sock over this sock to keep it in place. And if that's too hot, you can cut the foot off the sock and just put the top piece over that area to keep it in place. If you have any further questions or concerns, feel free to connect with your clinical educator about any other issues you may have.